Hello, this is Dr. Haddad, the Chief of Staff at Water Health. I'd like to give you a bit of an update about our clinical services as of today, July 11th. Fortunately, over the past few weeks, we've been able to ramp up our clinical services quite nicely. We're up to about 80% now of our pre-COVID capacity. We're hoping to be up to 100% in a couple of weeks. Now, this is our time between July and next fall to try to catch up on the backlog of patient cases that have been created by the pandemic back in March. As you know, we had to cancel our elective cases back in March and only maintained urgent and emergent procedures at the hospital. I encourage all of you to get your elective procedures done before we potentially can be facing a second pandemic. I really hope this doesn't happen, but we need to be prepared. So the hospital is already preparing for a potential mini bump or a second wave of COVID-19. It could potentially be concurrent with the time when influenza hits again in November or December. So in the meantime, though, the hospital has been free of COVID for the past 4 weeks. The whole prevalence in the community as well has been quite low, and this is our chance to catch up on things. The hospital itself is very safe. We have invested a lot of time and effort and resources to ensure that all the facilities are pristine, clean, and as you know, we do observe a universal masking policy to protect you as a patient and your guests and also our staff. We continue to do our best to provide you with the safest possible environment to be cared for. Our emergency volume has gone up to almost pre-COVID levels as well, and our biggest goal now is to actually just catch up on the backlog and get ready for a possible second wave, albeit hoping not to even face that, but you never know. We have to be ready. In the meantime, if you have any questions, feel free to reach out to our communication department or patient experience office as well, and you will be notified by your own physicians and providers about the time when your tests are being booked or procedures to be done. I encourage you to keep those appointments because we are doing our best to serve you as soon as we can. Thank you very much, and please enjoy the summer and this weather as well.